Hey, my name is Dr. Nicholas Howland. I am a board-certified plastic surgeon by the American Board of Plastic Surgeons. I practice right here in Draper, Utah. The purpose of this video is to introduce you to my YouTube channel. I have a lot of social media elsewhere, Instagram, TikTok, and we post a lot of fun content there. But I want to in particular use the YouTube platform to be able to educate people about plastic surgery, and in particular my unique approach to plastic surgery. I've always felt like one of my missions in life is to take the shame out of plastic surgery, and so our approach is really from the inside out. I believe that plastic surgery can be very empowering, one of the most empowering things that you can do for yourself when it's done for the right reason. And so my approach is exactly that. It's a whole body, inside out approach, so that when you do have plastic surgery, you can see on the outside how you really feel on the inside. I want to talk a little bit about semaglutide. I've been pretty outspoken on my social media in the past about these medications. So Ozempic, Mounjaro, tirzepatide, semaglutide, they all are very similar medications. They work as what's called the GLP-1 agonist. GLP-1 is a glucagon-like peptide. And before we kind of dive into the pros and cons of it, the issues I have with it, let's talk a little bit about how they work and what they do throughout the body. So we're going to kind of refer to this chart up here. The very, very first thing, one of the most important things that they do is they suppress appetite. Okay, all right, I want to talk a little bit about semaglutide today. Semaglutide sales in the last year have gone up over 350%, which is insane. And I've talked a lot about semaglutide on my social media before, and I want to talk really in a more long form here about the pros and the cons, and we'll get into my issues and not issues with the drug. But first, let's talk about semaglutide and really GLP-1 agonists. That's the type of drug this is. All of these drugs act similarly. Mounjaro, tirzepatide, Ozempic, semaglutide. So before we dive into the pros and cons, I want to talk about how these drugs work in general. So here on my screen is a great chart that I typically use to walk through with my patients if we are going to start one of these medications. I want them to understand exactly what this drug is doing throughout their body. The first and foremost thing is this drug has effects on the pancreas, and it's going to stimulate certain cells to release insulin, and it's going to cause other cells to lower their release of glucagon. This is the whole reason this drug was invented, y'all. This was for type 2 diabetics or even type 1 diabetics to help with their insulin resistance, to help it release more insulin so that their diabetes is better controlled. But GLP-1 as a peptide or a protein has all of these other effects throughout the body. And so when we created this drug to help with diabetics, we started noticing other side effects. Some of those side effects that we saw are just other areas where they act in the body. And the one that's most important now, and probably the reason this drug is shot up 300+%, is right here, the effect on the brain. So GLP-1, and when it's released, acts at your brain to tell your brain you are full. And so an agonist is a drug that acts similar to or increases the actual protein or the peptide. So these drugs act to increase the effect of GLP-1. So essentially, we're putting a drug in our body that's now making more stimulation of the brain by telling it like, hey, you're full, you're not hungry. And so that in turn leads to weight loss. It has another effect that also helps with weight loss, and that's on the stomach. It slows gastric emptying in the stomach. What that means is food that goes to your stomach stays in your stomach for longer, and it's not released into the large and the small intestines. And by staying there, it helps your stomach and your body feel fuller for longer, because your food is not getting released and then metabolized and digested as it normally would. Those are the big main four things that I go over. There are effects on the heart, there's effects on muscle and other areas of the body, but those are the four main ways in which this drug works. Now, let's talk a little bit about my issues with the drug. I think it's a great drug. Semaglutide, when it's used for the right reasons, in the right patients, can be a great drug. And when I say semaglutide, I'm referring to all of these GLP-1 agonists. The issue I have with this drug, though, and this is something I see a lot in my industry, in plastic surgery and health and wellness. This new drug comes along and we promote it and we push it, and the prescribers push it, and there's big dollar signs and big margins associated with the drug, and prescribers suddenly see dollar signs and they stop really taking the time to explain the pros and the cons to their patients. Most providers, I'm not throwing anybody under the bus here, and I am not sugarcoating this at all. Most providers do not go over all of the pros and cons of this drug with their patients. They will tell you, hey, this is a great drug for weight loss, and you might have some side effects like an upset stomach or some nausea, but that's it, go ahead. And they don't tell them anything else. Here's my biggest issue with the drug, and what I think is the most important reason to use this drug safely. When they originally looked at these medications and how they worked and did their studies, everybody lost weight, and weight loss was across the board, and that's a great thing. Awesome, weight loss, this is great, this is what we're looking for. However, when they finally started doing studies looking at the composition of weight loss, things changed significantly. So a good, healthy weight loss, if you're gonna do a good, healthy diet and exercise plan and you lose 20 pounds, okay, 75% of that should be fat. 25% will come from other sources such as muscle, bone, and elsewhere. And so that's a good, healthy balance of weight loss. 75% fat, 25% everything else. When they looked at the composition using DEXA scans of patients who were on GLP-1 agonists and did not really change their diet or their lifestyle, they just started the drug, the composition actually flipped. 75% of the weight loss was coming from protein and lean muscle mass and bone density. Only 25% was coming from fat. So in essence, by a percentage, these patients were actually getting fatter. They're losing numbers on the scale, but their ratio of fat to muscle mass was actually shifting. That is horrific. The reason being is lean muscle mass. Lean muscle mass is the number one indicator for longevity in your life. Think about it. As you start to lose muscle mass, you start to lose the ability to take care of your joints and your bones, and they become brittle. And eventually, think about most old people that you hear about. What happens? They hit 75, they have a fall off the curb, they break a femur, they break a hip, then it's a long, slow ride to death. And it's because they don't have enough lean muscle mass to maintain the strength of those joints and those bones. And so one of the most important things you can do in your life is maintain lean muscle mass with protein intake and with regular weightlifting. And so if you have a drug that comes along and helps you lose a lot of weight, but it's mostly lean muscle mass, that is terrible. That essentially is cutting years off of your life. So I hope you feel good in the smaller pant size that you got to, because you just lost 5 or 10 years off of your life. Now, again, I don't hate this drug and I prescribe this drug, but I do so very, very safely. So I have some hardcore regulations for every one of my patients on this drug. Number one, protein intake. You want to take about a gram per body weight in pounds of protein a day. So if you're 200 pounds, you should be trying to get 200 grams of protein a day. And I will tell patients, I don't care if you're not hungry, I don't care if the drug is doing its job, you get your protein in. Number two, you've got to be regularly lifting weights at least 3 times a week. That is just going to help maintain your lean muscle mass while you're also using the GLP-1 agonist drug. You have to be counting your macros. This doesn't have to be complicated. You can just count your protein, your fats, and your carbs. And the reason for that is GLP-1, just like any other peptide or hormone in our body, once you start taking medications that what's called exogenously, so meaning from an outside source rather than your own body, your body can start to naturally not produce it as much. And so I have the same conversation with patients on testosterone. Once you start injecting testosterone, your body's going to stop naturally producing it. And so you're kind of on it. GLP-1 agonists are similar. Your body will stop producing as much natural GLP-1 when you start injecting these medications. And so we've seen a lot of patients who have come off of these medications and they just stop cold turkey. They don't taper. They're not counting their macros. They haven't really changed their lifestyle. And so now this GLP-1 signal's not getting released. They don't know anymore that they're not hungry. And so they start to binge eat and they're not counting their macros. So they don't know how much they're taking in, what's normal, and all of that weight comes right back up. And so it's extremely important to slowly come off of these medications, count your macros, and if you do that, you'll likely be able to maintain the weight loss that you achieved. Those are my big things for anybody going on this medication. There's a lot more that we can dive into and that we will dive into in more series, but again, it's a great drug. It absolutely is. It helps, especially in diabetics and pre-diabetics, and even for people who are struggling with some weight loss. But you gotta take it in the right way. You've got to go to a provider that is gonna tell you how to take it in the right way so that it can be as beneficial for you as possible. Let me know if you have questions.